Senator Reid mentioned the two insurers that control 80% of the market, because I was concerned by earlier this year when those two insurers requested rate increases of between 11 and 16% for small and large health insurance groups in the state. They ended up withdrawing those increases when there was a lot of public pressure about those. But we have reason to believe they're going to come back again with double-digit rate increase requests. One of the things they were trying to do was increase the amount that they were going to spend on things other than health care to nearly 20%. They were 15 to 17% they're spending on administration, as well as a few percent on profit and reserves. So my concern is, are we going to, what can we do through healthcare reform to make sure that 20 cents of every dollar that we're spending, we're not putting 20 cents of every dollar into things other than healthcare?
One of the things we're going to do is have a much more transparent system where insurance companies will have to report how much they actually spend on healthcare versus other categories, reimbursement of their executives. So, and I think, again, this could be powerful knowledge for people to make judgments about the carrier they want and the coverage they want. The other issue goes back again and again to this point where our basic premise is that if we can establish a competitive market for healthcare that is judged by the consumer based on quality and price, that would be the best sort of antidote to kind of the disease continuing increase. Besides, it will, we think and we hope, it will prompt a lot of effective sort of innovation in terms of information sharing, in terms of using best practices, all those things which we believe and we see evidence that is reduced costs. So I think again, the interesting sort of success story here is that we're trying to build more competition in a system that certainly has no competition. And if we do that, I think that's consistent with our overall view of how we should operate our economy. We'll have better outcomes for the future.
I think if I could just add to what Jack said, one thing that is also to me significant about the public option was shown by United Healthcare, which in 2007, I believe, asked to take $37 million out of Rhode Island profits to pay back to headquarters. And at that point, if I recall correctly, they had a 16% market share. So if you take the number of Rhode Islanders who had insurance, and then you take 16% of that number, those people coughed up $37 million that provided exactly zero to Rhode Island health care and went to profits. I think that's a place where a public option deal provides some healthy competition alternative. This gentleman has had his hand up a lot, so let's go to him. And then there's a lady in the very back row who's had her hand up for a long time, so we'll go to you after that. Sir. I'm trying to get a little bit for everybody. Sorry if I'm not.
Oh, you're holding it. Sorry. My name's Dick. I'm from Providence. And contrary to the gentleman from Germany who said, you're 75. I was 75 when I contracted cancer. So I'm going to preface my question a little bit here and say I didn't get thrown out by my healthcare system. I had chemotherapy, I had radiation, I had surgery, 2 surgeries, and here I am 5 years later, I'm still around. My healthcare system's working okay, but my question...
What is your healthcare system?
I have blue chip for Medicare. My question, we talk about all the things we're going to do. We're going to introduce this and that and the other thing. We're going to cover all these people. But I don't hear anything about cost. And the question I have, and I'm going to direct it to you, Senator Reid, because I saw a comment of yours in the paper today, is that malpractice insurance, malpractice cases take an awful lot of money out of the system. First of all, we have all these doctors today who are leaving private practice. We have medical students coming up who don't want to go into private practice because they can't afford to pay the malpractice insurance. We need primary care for people. So why are you and President Obama saying this is not an important factor to consider? I think it's a very important thing. And the lawyers are going to get 40% out of every malpractice case, so I'm sure the lawyers love this.
It's been estimated that malpractice adds about 2%, malpractice litigation, 2% to the national health care, which is not insignificant. This is an issue that we're going to debate again when we get back to the floor. Frankly, one of the things that surprised me is this was not a major issue by our Republican colleagues in the committee. They're probably waiting for the floor and there'll be a debate. Well, they proposed, we had 600 amendments. They
What do you say about the 2%? How about all these doctors that are leaving the healthcare system? And the ones coming up, they don't want to have a private practice.
Let me just try to write. There have been, first of all, most tort reform is based at the state level because that's where the litigation is. There's been about 42 states that have incorporated significant tort reform. In those states, premiums have at times been reduced. Sometimes they've just stabilized. But the overall health care costs keep going up. So if we're concerned not about premiums, but health care costs, that's not the silver bullet that's going to fix what we need to fix. It's something we should consider. The other issue, too, is about the issue of sort of malpractice and why doctors aren't going into it. I heard, do we have any Brown medical? How many are going into family care?
Over here too. That's.
We've got 3. And how many are making a decision to go into a specialty which has high malpractice based upon the malpractice? 1. OBGYN. Yeah, you're going in. But the point is, we have a problem with family practitioners. We have a problem. They're under the Federal Torts Claim Act. So they have malpractice, but it's a difference. You're right. You're right. But the problem, I think, is what we're seeing is this goes back to your point about we need more primary care. And I'll stand corrected because these young people have been studying issues better than me. Most of the specialties pay higher malpractice rates than a family care practitioner. So I agree with you. We need more family practitioners. But by changing dramatically malpractice, we're not going to do that. And in fact, we've got so many students going into specialty practice like this, they're prepared, I guess, to accept it. But this is an issue that you've raised. It'll be raised again. And I just want to put on the table the facts that I understand. Yes, sir.
How much do you and Senator Whitehouse contribute to your health care plan, which is a real Cadillac system, right?
I'm going to be very candid. You should ask my wife, honestly. I'm not This is a public program. We'll put it up on the website tomorrow. It will be on our website tomorrow. Okay?
That was good, though. I like that one.
This lady in the back would have the next question. She was surprised already to this microphone. And, go ahead.